Welcome to the virtual Wednesday edition of Getting the Word Out from the Bethel Baptist Church of Pasadena, California, where John T. McCall is our senior pastor. We pray that our Bible study ministry blesses you greatly. Meanwhile, if you'd like to be a blessing to the Bethel Baptist Church ministry financially, you can do it at bethelpasadena.org. Just click on the Giving tab and follow the instructions. Your support of this ministry is greatly appreciated. Our pastor is coming with an anointed word. Again, thanks for joining us here at Bethel Baptist Church of Pasadena.
Welcome in, everyone. I'm Pastor John T. McCall of the Bethel Baptist Church in Pasadena, California. Today, I am delighted to continue our discussion regarding the COVID vaccine and its impact in the American community. And today, I have another special guest, knowledgeable about the vaccine and has had years of practice. My special guest today is Dr. Kimberlyn Ashing of the City of Hope. Give her a hand as she comes today. Welcome, Dr. Ashing.
Welcome, Pastor. I'm really delighted to be invited in this, very critical time of COVID-19 and how it's impacting our community, and just feel very blessed that the church is taking a leadership role in presenting the evidence and the data that's so relevant for our community making the right decision on the COVID-19 and vaccination.
Thank you. I'm so excited to have you on today. Can you tell us about your work at City of Hope?
Sure. So I joined City of Hope about 16 years ago as one of the first African-descended full professor at City of Hope. And my role focuses on addressing community engagement, community benefit from our research, and engaging the community in our priorities in terms of the research that we're conducting at City of Hope. As you know, City of Hope is a comprehensive cancer center within the Southern California area. And we have been around for over 100 years doing phenomenal work in terms of advancing the science of cancer care, diabetes care, and HIV. So we are just delighted to be a part of the Los Angeles community, serving our community to increase the health and well-being, especially regarding cancer care. And my work as the Director of Community Engagement involves really bringing the community to City of Hope and City of Hope to the community.
Well, thank you. Can you tell us a little bit more about your background?
Yes, well, my training is in clinical psychology. I'm a licensed clinical psychologist. Most of my work focuses on focusing on the impact of cancer, so quality of life and quality of care, aspects of cancer, how cancer impacts the family, as well as the individual who's affected. And an important piece of my work is bringing science to the community. So we strive to make science more relevant and more applicable to daily life, as we have in this situation of COVID-19, that we're recognizing the issue of trust in science and how science has treated the Black community and how the Black community has benefited or not benefited from science. And these are the things that we're trying to address at the very root level and making an impact on the community striving to be included in the scientific process, because through medical advancements in science, we're developing, treatment advances. We're developing new therapies to help reduce the impact of cancer, to help, treat cancer with less side effects. And in fact, developing a vaccine. We're developing a vaccine at City of Hope for COVID-19, and really understanding the impact of COVID-19 and how we receive the vaccine and the science behind the vaccine, and how those messages are being delivered to our community.
Okay. You know, given the history with African Americans in science and medicine, can you talk about the impact it's having within the African American community, the resistance or reluctance, the ambivalence of receiving the COVID vaccine?
Yes, I think our history with the medical community, our great civil rights leader, we just celebrated his birthday, Dr. Martin Luther King, said that of all injustices, the injustice in the healthcare system is the most shocking and inhumane. And so correct, because medicine is intended to heal and to cure and to bring health and wellness. And that hasn't always been the case for our community. And there is what I call medical concern. I think sometimes um, the scientific community or the public health community may call this medical mistrust. But I think that terminology really, for me, blames the victim, as though we are a distrusting community. But in fact, this medical concern and medical hesitancy has its place in history, and it's an appropriate concern and adaptation to how we were treated, and even continue to be treated by the medical community. So I think there has to be relationship building and an awakening. And I think our Black Lives Matter movement has raised all of our collective conscience. And so we are in a better way than we've ever seen, I think, for a long time in this society, really coming to understand the experience and the oppression of the Black community in society in general, but certainly in terms of medicine, and raising our awareness of how to better improve our relationship and our quality of care, and treating Black patients with the respect and dignity that we deserve.
Wow. You know, I've, this notion of messaging, and how do you get the message out regarding the vaccine? I think early on, has been concerns of previous administration in terms of the messaging regarding the virus and the vaccine. In retrospect, what would be some suggestions that you would offer as more appropriate or culturally relevant messaging that needs to be done?
Yes, I think, like medical mistrust, we also hear from the scientific community the term vaccine hesitancy. And again, I think that puts the blame on, that we are distrusting. I think the rollout has to use positive framing terms. So terms like vaccine acceptability would be much more welcoming. I think when we use certain terms, it makes it normative to think that we don't want the vaccine. And that's not always the case. Yes, we may have more concern about the vaccine, but given the right messaging from the right messenger, we can be vaccinated at the same rates as other populations. And we find that the rollout is showing that we're not being vaccinated at the same rates. Even our healthcare workers are not being vaccinated at the same rate. There was a report that came out from um, the Kaiser Family Foundation, indicating that we are being vaccinated at a lower rate. So, who are the messengers that are being, partnered with? So, healthcare departments, healthcare systems, hospitals, and community advocates need to partner with persons such as yourself, Pastor McCall, and trusted members of our community to explain the science behind the vaccine, that the vaccine
Yes.
is safe and effective and reduces um, the rate of COVID-19 infection by over 90% for most of the vaccines, and
Yes.
that using terms that would tend to give information and normalize our concern, but normalize our willingness to be vaccinated as well. I've received two doses of the vaccine, and actually, in my second dose, there was actually a lot less, injection site discomfort as with the first. And for me personally, had no side effects other than very mild pain the first time for about 24 hours, and actually the second time, almost none at all.
Okay. I'm glad you mentioned the messaging and partnerships. Watching, I think, a CNN report this past weekend, it said that less than 6% of African Americans nationwide have received the vaccine. As a pastor, it's concerning to me because infections that lead to death leads to funerals, and just the impact in the community with families, churches, is just so concerning. And then to watch those members who've been infected to go through that process of not being able to breathe and possibly being hospitalized. Had one family, the entire household became infected, and so you're praying and you're concerned, but you're hoping that the right message gets out there so we can make the right decision. When you mentioned the partnerships, I'm so glad you mentioned that because for me in my lifetime, it's probably one of the biggest health crises that I faced. I was thinking back the other day as a kid, um, taking the polio vaccine, and
Yes.
I think with the sugar cube, and then we got an injection as a kid in the arm with some gigantic machine that left an imprint. I don't remember what that was, but I just remember going through it. Now we're facing this medical crisis, and how would you suggest pastors like myself or churches about partnering and teaming up with the right connections to get the word out about the vaccine?
I totally agree. I think those of us who remember polio, there was great enthusiasm about this vaccine being available, right, to prevent this very disabling and sometimes deadly disease. And so we have to bring back that level of enthusiasm. So I also use that term. So we have to use terms like vaccine acceptability, vaccine enthusiasm in our community, and to show real stories about families being affected by this deadly disease, COVID-19, and show families who are being vaccinated. And yes, there are challenges with scheduling appointments for the vaccine, but churches and other community advocates can help navigate some of the systems. It
Yes.
requires sometimes online scheduling, so being able to be a resource for the community, as well as spreading the word in terms of knowledge, right?
Yes.
It's important that our people have the knowledge to make the right decisions for themselves, and to understand that this disparity in the COVID-19 is real. It is affecting our community. We have a 2.5 times greater mortality due to this disease.
Wow.
And therefore, we need to advocate for our communities in terms of policymakers, hospitals, those who are delivering the vaccine, that our community who are more greatly affected to be prioritized for vaccination in the dissemination and the rollout, but also building, like I said before, the correct partnerships so that these rollouts are successful and that we have a community that's enthusiastic about being protected, that we have a community that's enthusiastic about the prioritization within the healthcare system, that we have a community that's enthusiastic that now the healthcare system is doing right by us.
Yes. I have a saying at the church that the best church is an informed church, of informing people of what's going on. And then you can make better decisions when you're informed and you have the correct information, be able to make a right decision. And because this virus is impacting life and the quality of life. I did a funeral last week,
No.
talking to the mortuary person who was there. And he said to me, he said, I would have never thought that we would be turning away business. He said, but we're overcrowded. And he said, we can't handle it. And I'm like, man, how are you dealing with this? And he just said the pressure, the sadness, the grief. And as a clinician, as a pastor who's a trained clinician, understanding the trauma of losing a loved one, not being able to be in the hospital by their side, to touch,
Yes.
to say goodbye, and then having a graveside service, where you really can't do what you normally do as a church to comfort the family. And for me as a pastor, I'm hands-on, and so not being able to go by the family's house, meeting by Zoom, meeting by phone, planning the details, praying by phone, can't touch, can't put hands on, it is so disconcerting. And I think for me, the long-term impact of that, of having to deal with those families who've lost loved ones, and then just the fear factor of being afraid, of the members who've had it, who I've talked to, they're so afraid of what may happen, how this disease may progress and cause future harm, and so it has all of us on alert. And so I'm hoping through this conversation that we had with doctors on last week, with you on this week, especially pastors and churches, we would become more active, proactive, and insert ourselves in the process to ensure that the right messaging, the right partnerships are out there, because this virus is impacting us.
Yes.
Who look like, and people who look like me, and so I'm concerned. And I'm not sure. Go ahead.
I've been touched by what you just said, because as a clinical psychologist myself, I'm just mindful of the fact of the grief process that families have to go through. Like you said, yes. It's done now in isolation, yes. and what a heavy burden to bear at a time of loss. And yes. So that reminds me of the role of the church in comforting. But like you said, all this is done via Zoom now. And it raises the importance of, even as the vaccine becomes more available, that we ought to be mindful of practicing our preventive care, right? Yes. So wearing the mask, social distancing, and hand washing, proper hand washing. Yes. So, teaching kids, singing happy birthday to you, gives them enough time to wash their hands properly, wash underneath their nails, and to make sure that they are, being protected, because even though they may be less affected, if they are interacting, our youth, and interacting with friends, and they come home and their grandparents or elderly ones, we may be, increasing their risk. So clearly, even though we have a vaccine that's effective and it's now becoming available, we still need to be very thoughtful and mindful of our preventive practices. which
Yes.
seem to be in our own evaluation of over 100 community leaders across different ethnic groups, Black, African American, Latino, Koreans, and Filipinos, that
Yes.
they're reporting that our community is also practicing those preventive measures
Yes.
at a lower rate. So
Yes.
we need to recognize, the seriousness of this illness and the fact that we are experiencing this loss and isolation. And we do have preventive measures that includes, again, mask and social distancing and proper hand washing, as well as vaccination as it becomes available
Yes.
to first our healthcare workers and our first line folks, but to be mindful that we need to sign up and get our parents and grandparents signed up for the vaccine.
Yes. You mentioned hand washing. I'm working on a video right now with one of our nurses
Mm.
to teach how do you properly wash your hands. We say it, but a lot of people don't know the process for for proper hand washing. And so I'm always into teaching and training and showing. You can tell it and say it, but if you don't know how to do it, then you can't do it appropriately. And so, just for me, just those kinds of informational tidbits for people to see and say, "Oh, I didn't know that." It's not just a quick wash. You know,
Right.
yes,
You have to lather up your hand
yes, yes,
under your nails. And this is
yes,
especially important for our children too.
yes,
They're learning
yes.
healthy practices from early on.
hmm and so for me, information is just critical in being able to take care of ourselves and making an informed decision. You mentioned City of Hope is developing a vaccine. Can you talk about that?
I'm not involved in that process,
Okay, okay,
McCall, but it's in its first phase. So, vaccine, just like this one, we had rapid advancement of this vaccine of COVID-19, the one
okay,
that's available, Pfizer or Moderna.
okay,
And that went through a certain set of steps, right?
okay,
They look at it in a petri dish in the lab, how it blocks the virus. Then it goes through various safety and efficacy before it goes to humans. And then,
okay,
so there's a first phase trial, which is a small number of persons who will receive the vaccine to assess safety and efficacy and
okay,
dosing and all of that in humans. And so
okay,
that's where we are with this vaccine at City of Hope. So we are in the first phase of testing this vaccine, and very excited about it, and hopeful that this will be also an additional opportunity to
okay.
prevent the COVID-19 virus from
Right.
spreading.
Many of our viewers may not be aware of all the richness of City of Hope and what City of Hope does. Uh, I'm into research, and so I'm constantly going on the City of Hope website and looking at the research you've done in our cities, looking at health disparities and making recommendations. Can you elaborate on some of the things that City of Hope is involved in?
Of course. Thank you, Pastor. Well, we want to bring the advances of healthcare to our community, especially the Black community that's most affected not only by COVID, but by cancer and other chronic diseases.
Yes.
So we know that some of these illnesses are really related to our standing in our society, the sense that we live in communities that have less access to healthy foods. We live in communities that have greater density of, say, tobacco and vape shops. We live
Yes.
in communities that may be closer to freeways. We live in
Yes.
communities that have greater pollutants.
Yes.
So all of these things work together for not for our good,
Yes.
and make us more vulnerable to illnesses. There are also some beliefs that the stresses of discrimination that we have experienced from very early in our arrival as indentured slaves and our continued devaluing in society also is a public health threat to us
Yes.
as Black folks,
Yes. Yes.
and that weighs on our health. And so we have to be even more vigilant of our temple, right?
Yes.
As temple of the Holy Spirit. And so some of the screenings that's available, right? It may be guided on the general population. For example, colon cancer screening. Colon cancer screening is life-saving. The
Yes.
guidelines say 45. For us, we may need to start screening at 40, and it's important to know our family history.
Yes.
So if you have a history of colon cancer, like I do in my family, I actually started screening at 35.
Yes. Yes.
And the colonoscopy, people get concerned about the colonoscopy and the process. I'll tell you, I watched my father die from colon cancer.
Yes.
It's a lot less uncomfortable to get a
Yes.
colonoscopy than it is to die from colon cancer.
Yes.
It's a lot less uncomfortable to have a prostate exam, to have a digital rectal exam, to have
Yes.
your PSA than to die from prostate cancer. It's a lot less uncomfortable to have a mammogram than to suffer
Yes.
from breast cancer. And the same with cervical cancer. A lot easier to have a pap test and to have the HPV virus test, as well as to have the HPV vaccine. Vaccinate your kids. I vaccinated my kids.
Yes.
The earlier we vaccinate before age 13, 12 or 13, it has better immunogenicity response. So, and it doesn't mean that we are permitting our kids to behave in any particular way. This is a cancer fighting vaccine, the HPV vaccine, and it's safe and effective. It's covered by health insurance. And even if you're not insured, it's actually covered for our kids by the state of California. So there are clear reasons why we are more vulnerable to illnesses, as I mentioned
Yes.
earlier. And there are reasons why we have concerns and some caution regarding our healthcare system. But we have precautions today against medical discrimination. If
Yes.
you are in a study where you have an illness, for example, if you are at City of Hope and you are in a clinical trial as a cancer patient, you will not get a placebo. You will get a new treatment or you will get the standard of care. No one goes untreated today if you have an illness and you're in a clinical trial. You will absolutely get the treatment that's available, the standard of care it's called, or you will get the new therapy that hopefully would be better with less side effects for us.
Uh, I am so excited talking to you on today because in the quote unquote Black church, the pastor is more than the pastor. He's the psychiatrist, the psychologist, the social worker, the lawyer. The pastor means so much to the membership. And I'm an advocate of good health. Maybe, I think 9 years ago, I had prostate surgery.
Ah,
My father passed away with prostate cancer. And so my doctor shared with me, it was just starting, and they wanted to do what was called watchful waiting. I said, "What's that?" They said, we want to watch and see what it's doing. And I said, well, it's trying to kill me. Uh, and so I said, remove it. And so I had the surgery, no complications afterwards, been cancer free now. And in talking to members of being able to make an informed decision about your health, that fear, of not moving immobilizes you, and you wait. Many times we wait until it's too late. And so information, I think, is powerful in terms of what we're responsible for. And I always tell our members, the longer you stay healthy and well, the less stress you have on me, because I don't have to pray for you as much. I don't have to come see you. I cut down on my hospital visits and funerals.
Yeah.
It's important that you stay in good health. Practice the things that are going to maintain your health. And when you have to make a decision, we'll hold your hand, guide you through it, but make that decision. Don't be paralyzed by fear of what could happen, because you know what will happen if you don't make that decision.
Yes. Yeah. And it's sort of, ironic, Pastor, because like you said, there's a lot of fear in the community about cancer. And that fear is actually kind of self-fulfilling, because the fear is that when we know someone who's had cancer, they've passed away without realizing that it was late stage diagnosis, it was end stage diagnosis.
Yes.
We have diagnostic tests, we have screening tests.
Yes.
So if you do those, you're not looking for a cancer that's not there.
Correct.
These tests would only find a cancer that is there.
Yes.
And it will find it earlier, where we have life-saving treatments, life-preserving treatments. And for some cancers now, like prostate and breast cancer and cervical cancer, curative treatments. Even prostate cancer when caught early. The colonoscopy, for example, is both a diagnostic test as well as a treatment. They can snip out, tiny polyps when they see it during the colonoscopy. And then you don't have to worry about this polyp becoming cancer. So this very fear is what is working against us. And so we joining with the church that's always been part of the leadership and the shepherding of our people out of many trials and tribulations, including now one of our greatest trial and tribulation is our health status. We are dying prematurely more than any other group. And many of these are preventable, and giving the knowledge, working with our health practices, both our screening practices, as well as working on healthier diet and nutrition and physical activity, cutting up the rug and dancing with your kids. I do that all the time, especially now that we are kind of locked in with COVID. You can turn on the music. If you want to do praise dance, do that. But if you want to do, other kinds of dances too, because, our kids are listening to other music, we have to be, open to including them in our circle and starting good health practices very early on for the whole family, because, the family is the source of healing and strength.
Yes. One of the messagings I'm trying to correct in church is, well, Pastor, I have faith and I'm going to trust God. And I'm like, yeah, but faith without works is dead. And so I believe God put doctors here, put medicine here. And so your faith is in God. But if you're having a heart attack, somebody's going to call an ambulance and you're going to a hospital. And you still have faith to believe that you're going to be healed. If you break your arm, you're going to a doctor and have your arm set and a cast put on, and you have faith that your arm will heal. And so this notion of faith and not doing anything, to me, is poor messaging. Faith without works is dead. And you have faith, but you do your part, and then trust God to do the rest. And, biblically, our healing comes from God. and that the doctor is the instrument, the medicine is the vehicle that's used for curative purposes. And I'm so grateful today because I remember, growing up in the South, man, some of the remedies they used, then today would be in trouble. I mean, but it worked then. Uh, but today, God forbid, some of the things that they said were curative. And so, and I'm grateful today for modern medicine, of all the advances that have been done. So, if you could give me 2 or 3 suggestions for the viewership today of messaging to move out of fear to taking action, or messaging that would cause them to go and take the vaccine, that'd be.
I think, Pastor, exactly what you're doing. So you're giving people the information for them to make informed decision. And we're hoping that that decision would be towards vaccination. But we know that we could only provide the knowledge and information and provide the resources and to make it in a way that's from trusted members of our community. So exactly what you're doing, Pastor McCall, in terms of bringing the knowledge, bringing the experts of people who look like our community, our diverse Black community, also want to bring in, even as we close, our immigrant Black community that I'm a part of. So our Black community also is diverse. And so we need to reach all segments of our community in terms of bringing the right knowledge of using terms like vaccine acceptability, vaccine enthusiasm, raises our interest and normalizes healthy behavior, as opposed to normalizing what other people put on us in terms of using words like mistrust. Well, there's a reason for that. And why call it mistrust when you've done us wrong? That's not mistrust, that's adaptation.
Yes,
So call it what it is. And so we are adapting to our environment. And it is incumbent upon the medical community to do justice, to begin to treat our community with respect and dignity. When someone comes in with for a medical exam, to talk about the screenings, to talk about prostate cancer screening, because it does affect Black men more, to talk about colon cancer screening, because it does affect our community more, to bring up tobacco control, because there's marketing directed at us. The health community needs to treat the whole person. And in that sense, we'll feel like we have a medical home and trust. So when the issue of vaccination comes up, we're like, oh, yeah, my healthcare clinician cares about me and understands my community's plights. And so I will, believe in the information that I'm getting from my health, care clinician. I will believe that information, and that healthcare system, joining with churches and advocacy organizations, would make it more welcoming for our community to be, open to what is this information about the COVID-19 vaccine, and be more willing, like I was, to be able to get, the vaccine, so I could protect myself and my family and the patients and, the cancer survivors that I work with on a daily basis. I mean, now most things are being done via Zoom, but, we do have to be ready for a day where we go back to more normalcy. And if we're all vaccinated, we could be closer to that day sooner than later.
Yes. Well, I took my first dose several weeks ago. I go Monday for my second dose. My wife goes today for her first. And so I'm grateful for the vaccine. And today, you helped me with my messaging and being able to change now how I convey it to members and to others, and get some enthusiasm and some excitement going in receiving it, and moving from fear and negative messaging. Dr. Ashing, I want to thank you today for your expertise, your willingness to come on and to share today. I look forward to additional conversations and partnering with you and the City of Hope. Your organization brings so much to the community that we should be tapping into. And so I'm excited. And so thank you for your time on today.
Thank you so much, Pastor McCall. I really appreciate it. And I look forward to future conversations and collaboration to benefit the community, because it's so important to bring the messaging about our health and taking action for our health. So very important. So thank you and have a blessed day.
Thank you. Thank you. Thank you. Blessings to you and your family.
Thank you, Pastor.
Thanks for joining our Wednesday night virtual service here at Bethel Baptist Church of Pasadena, California. Again, visit our website for giving information and more. It's bethelpasadena.org. On behalf of Pastor John T. McCall, thanks for watching. If you're ever in the Pasadena-San Gabriel Valley area, we invite you to come in and visit with us at 1972 North Fair Oaks, Pasadena, California. To order a copy of today's message or for more information, log on to bethelpasadena.org or call the church office at 626-794-3136.
The heartache, through the trial, through the tribulation, Jesus.